Hello friends, hi. A very good morning to all. Welcome to my channel, The Voice of Nurse. Today we are going to discuss the midwifery and gynecological nursing point of view continuous part 2. We already finished midwifery and gynecological nursing point of view first to 30 questions in part 1. This is part 2, the continuous questions from 30 we are going to start now. In previous first part we already finished first to 30. Now we are going to discuss 31st question. Before moving on to topic, a small request friends. Those who are watching my channel first time, please subscribe my channel, click on the bell icon for further notification. To topic, we will discuss now part 2, midwifery and gynecology point of view. 31st question. Peg cells are seen in options. Option A, vagina. Option B, vulva. Option C, ovary. And option D, tubes. Peg cells. What is peg cells? Peg cells are present in fallopian tube, epithelial cells with the uterine tube. Peg cell stimulates estrogen during the first half of the menstrual cycle. So, peg cell is seen in tubes, fallopian tubes. Option D is the correct answer here. The additional knowledge related to peg cells. Peg cells capacitate spermatozoa, sperm, making them capable to fertilizing an ovum into the ampulla. The peg cells are capacitate spermatozoa, making them capable fertilizing an ovum into the ampulla. So peg cell is very important for the fertilization. So here peg cells are seen in tubes. Option D is the correct answer. Here we can see in this picture fallopian tubes is there. The upper portion, the tubes is there. Here peg cells are present. We can see peg cells in tubes. Next we move on to question number 32. The 32nd question. Fetal hemopoiesis first occurs in. Fetal hemopoiesis is first occurs in option A, yolk sac, option B, liver, option C, spleen, and option D, bone marrow. Fetal hemopoiesis. Fetal hemopoiesis means the formation of new blood cells. Okay friends, hemopoiesis means the formation of new blood cells. Here fetal hemopoiesis means the formation of new blood cells in the fetus. Here the fetal hemopoiesis first occurs in yolk sac. Option A is the correct answer. Embryonic hemopoiesis. Embryonic hemopoiesis begins in the yolk sac. Early hemopoiesis in the fetal liver occurs prior of full maturation of the hepatic vascular system. This is used to mature the hepatic vascular system also. Fetal hemopoiesis first occurs in yolk sac. Option A is the correct answer here. Next move on to question number 33. FSH secretion is stimulated by options. Option A, LH, RH. Option B, TRH. Option C, testosterone. And option D, estradiol. Here what is FSH? FSH means follicle stimulating hormone. FSH secretion is stimulated by GnRH. But here there is no option is GnRH. FSH secretion is stimulated by GnRH. GnRH means gonadotropin releasing hormone. But here there is no option means here option A, LHRH is also called as GnRH. Gonadotropin releasing hormone also called as LHRH. GnRH stimulates FSH hormone. Okay friends, GnRH stimulate the follicle stimulating hormone, releases the hypothalamus. Hypothalamus produces the GnRH, stimulates in the pituitary gland to produce the FSH. Here we can see here hypothalamus is secreted GnRH, pituitary gland to FSH and also LH also. The FSH and LHS into the testicles and it made to the testosterone. Okay friends, here in this picture you can see FSH secretion stimulated by GnRH, gonadotropin releasing hormone. Okay friends, Here one more additional point is there. The pituitary gland is produced FSH, the hormone responsible for starting follicle egg, means follicle means egg, female egg, follicle development also here. FSH secretion stimulated by LHRH or GnRH. Option A is the correct answer here. Next move on to question number 34. Signs of true labor are the following except. Option. What is the signs of true labor? In following options, one is the except for the signs of true labor. Options. Option A show. Option B dilatation of os. Option C fetal movement, and option D painful rhythmic uterine contractions. In signs of true labor, the regular contractions is present, and also patient will feel pain, and also increasing the vaginal discharge also, means show. Option A show, meaning of vaginal discharge, it is called as show. But here signs of true labor except means option C fetal movement. When the patient or one person is getting labor pains or true labor, they will not feel fetal movement at that time. So here they will feel regular contractions, feel at the pain and abdomen and low back pain, and also increasing the vaginal discharges. The amniotic fluid breaks, clear or pink and brownish color will be there in vaginal discharge. Here signs of true labor, the except condition is fetal movement. At that time fetal movement is absent. They will not feel fetal movement. They will feel show, dilatation of the os, and continuous pain and regular contractions and rhythmic uterine contractions also they will feel. Next we will move on to question number 35. Umbilical artery pressure is options. Option A 30 to 40 mm of Hg. Option B 60 to 70 mm of Hg. Option C 100 to 110 mm of Hg, and more than, option D, more than 120 mm of Hg. Here the approximate umbilical artery pressure is 50 mm of Hg, not exactly, approximately 50 mm of Hg. But here there is no option 50 mm of Hg. Related to in between is option B is there, 60 to 70 mm of Hg. There is no exact, approximate is 50 mm of Hg. Option B here 60 to 70 umbilical artery pressure is 60 to 70 mm of Hg. One more additional point here, the umbilical artery contains two arteries and one vein. Vein carries oxygenated blood from the placenta to fetus, and arteries or carries deoxygenated blood and the waste products from the fetus to placenta. Okay friends, and also one more additional point, umbilical artery pressure is 60 to 70, here option B approximately 50 mm of Hg. And also umbilical vein, what is the umbilical vein pressure? The umbilical vein pressure is approximately 20 mm of Hg. Okay friends, this is additional point. Next move on to question number 36. The 36th question is, amniotic fluid is changed and replaced after around every, means the amniotic fluid is changed and replaced automatically around every period, means how much is the duration. We will see the options first. Option A 1 month, option B 12 to 24 months, 12 to 24 hours, and option C 10 hours, and option D 5 hours. Here the amniotic fluid is clear the production rate of the fetal urine in the human fetus at term, approximately 800 to 1200 ml per day, the urine of the fetus. Okay friends, it is sufficient to replace completely in the entire amniotic fluid volume every 12 to 24 hours. Here option B is the correct answer. And also the amniotic fluid is changed and replaced around 20 weeks of gestational age. However, this is entirely replaced by fetal urine up to the third trimester. Here option B is the correct answer. Amniotic fluid change replaced 12 to 24 hours, every 12 to 24 hours. Next move on to question number 37. Braxton Braxton's Hicks does not occur with options. Option A, submucous fibroid. Option B, pregnancy. Option C, hematocolpus. Option D, none of the above. Here, what is Braxton Hicks? Braxton Hicks also called as false labor pains or prodromal pains. Braxton Hicks also called as false labor pains. Here, one of the main reason may have the baby prematurely if it is experiencing pain caused by your is fibroids. Option A. Here Braxton Hicks does not occur with a submucous fibroids. Is pregnant lady is having, the client is having submucous fibroid means they will not get Braxton Hicks. Here we can see the submucous fibroids in the uterus. Here in this picture we can see here. Let's move on to question number 38. The action of spermicidal agents is to options. Option A, prevent the motility of sperm. Option B, kill sperm immediately. Option C, prevent sperm from striking to the uterine wall. Option D, render the sperm immediately. Here what is spermicidal agent? Spermicidal agent means it is a kill sperm immediately. Means some kill sperm immediately. Option B is the correct answer. Vaginal spermicides are a type of contraceptive. This is one of the type of contraceptive method. These products are inserted into the vagina before any sexual intercourse begins. Before intercourse period, insertion will be done. They work by damaging and killing sperm in the vagina. This is one of the type of the contraceptive method. Spermicidal type of ointment available in ointment and suppositories and also tablets. Here the action of spermicidal agent is kill sperm immediately. Next, move on to question number 39. Which is the commonest diameter of engagement? Okay friends, what is the commonest diameter in the pelvis during time of engagement? Options. Option A, mentovertical. Option B, suboccipitofrontal. Option C, occipitofrontal. And option D, submentovertical. The diameters most frequently used and the average length thereof a occipitofrontal, that it is approximately in 11.5 centimeters, which is follows a line extending from the point just above the roof of the nose and also attached to the occipital bone from the root of the nose and the occipital bone. It is the occipitofrontal. Here we can see in this picture occipitofrontal diameter. Here the commonest diameter of engagement is option C, occipitofrontal is the correct answer. Next, move on to question number 40. Lochia is seen for how many days? Actually Lochia is a postpartum period. Lochia is seen for options. Option A, 1 to 4 days. Option B, 5 to 10 days. Option C, 10 to 14 days. And option D, 14 to 21 days. Lochia is vary, means it will different between the people. 1 to 1 it is different to the people. Lochia is lost about the 6 weeks. Some people have up to 8 weeks. Okay friends, here option D is the correct answer. It will come 14 to 21 days. Option D is the correct answer. The Lochia is having 3 phases. It will be first one rubra, Lochia rubra, second one is Lochia serosa, and third one is Lochia alba. Lochia rubra is first 4 days of the period and it is a dark red color, and Lochia serosa is 10 days. Second phase 10 days, it is pinkish brown color. Lochia alba, it is third phase, duration is 10 to 14 days. It is whitish discharge is present here in Lochia alba. Lochia rubra, Lochia serosa, Lochia alba is the duration period of Lochia is 14 to 21 days. Option D is the correct answer here. Next, move on to question number 41. A client calls the clinic after a home pregnancy test is positive. Which hormone will be high? Means the patient is already at home, pregnancy test is already positive. Which hormone is high in the pregnancy test? Options: option A HCG, option B estrogen, option C alpha fetoprotein, and option D progesterone. Here in this pregnancy test, the HCG is high, human chorionic gonadotropins. HCG is biological marker on which pregnancy tests are based. The only hormone produced during pregnancy, HCG, is made by the developing placenta. HCG levels rise rapidly in blood and urine during first trimester of pregnancy. Here the client calls clinic after home pregnancy is positive. The hormone is high is option A HCG. Next, move on to question number 42. Daily caloric needs in pregnancy about how much kilocalories? Options: option A 1000, option B 1500, option C 2500, option D 3500. Actually, the daily caloric needs or recommendation of the caloric diet is different in according to the trimester. We will see first the caloric needs about 1800 kilocalories per day in the first trimester of period, about 2200, approximately about 2200 kilocalories per day in second trimester, and third trimester 2400 kilocalories per day during the third trimester. Here the daily kilocalories means the calories needs pregnancy in kilocalories is option C approximately 2500 kilocalories. Here option C is the correct answer. Next, move on to question number 43. Bag membranes rupture means options: option A before full dilatation of cervix, option B after full dilatation of the cervix, option C after head is engaged, option D with show. Here bag membranes, sometimes the membranes break before a woman goes in a labor. Sometimes the bag membranes break before a woman goes into a labor. When the water breaks early, it is called as premature rupture of the membranes, PROM. When the fluid means amniotic fluid bag breaks early, it is called as premature rupture of the membranes. And in case the amniotic fluid or water leaks before the 37 weeks of pregnancy, is called as preterm premature rupture of the membranes. Here option B is the correct answer. The bag membranes ruptured after full dilation of the cervix is the correct answer. Next, move on to question number 44. Amniocentesis is best diagnostic if done in which weeks? Options: option A 8 to 10 weeks, option B 14 to 16 weeks, option C 20 to 22 weeks, option D 18 to 20 weeks. What is amniocentesis? Amniocentesis is a testing a sample of cells from a amniotic fluid surrounds the baby in the womb. This is one of the diagnostic test. Amniocentesis is a small sample cells from the amniotic fluid surrounds the baby in the womb. Here option B is the correct answer. 14 to 16 weeks the amniocentesis diagnostic test to be done. The additional point of amniocentesis is usually carried out between the 15th and 20 weeks of pregnancy, but it can be done later necessary. If it is necessary means after 20 weeks also the pregnancy also can done. This may be increase the risk of complications of amniotic fluid and usually to be avoided. Amniotic fluid to be test may be offered during pregnancy to check baby has genetic or chromosomal conditions. Any abnormal conditions related to genetic and chromosomal related diseases to identification to be done in amniocentesis. For example, trisomy 21 and Edwards syndrome also, for example of the genetic and chromosomal conditions. Here we can see in this picture the amniocentesis procedure while using the ultrasound probe in the abdomen and syringe inserted into the amniotic sac. Amniotic fluid is collecting in here, amniocentesis. Next move on to question number 45. First stage of labor is up to. Options: option A, rupture of membranes. Option B, 3/5 dilatation of cervix. Option C, full dilatation of cervix. And option D, crowning of cervix. Here the first stage of labor, full dilatation of the cervix, is the correct answer, option C. We will see additionally the stages of labor here. The first stage of labor, the spontaneous onset of labor to full dilatation of the cervix. The stage of first stage, spontaneous onset of labor to full dilatation of the cervix. Next, second stage, it begins to cervix, full dilatation of the cervix to baby head moves down out of the uterus into the vagina. Next, third stage, the period following the completed delivery of the newborn to the placenta also. From the baby delivery to newborn delivery to delivery of placenta. And fourth stage is observation stage. Here we can see the full dilatation of the cervix. Here we can see in this picture the first stage, full dilatation of the cervix. Option C is the correct answer. Next, move on to question number 46. Commonest site of implantation of ectopic pregnancy. In ectopic pregnancy, the commonest site of implantation. Options: option A, ovary. Option B, ample. Option C, isthmus. Option D, interstitial. In ectopic pregnancy, also called as extrauterine pregnancy, the implantation of the egg is done in extrauterine, means it will be in tube pregnancy. Ectopic pregnancy is a pregnancy in which the developing blastocytes becomes implanted at the site of other than endometrium of the uterine cavity. For example, it can be occurs. The ectopic pregnancy occurs in ampullary, infundibulary and isthmic segments of the fallopian tube. It is approximately ectopic pregnancy, approximately 85% cases we can see ectopic pregnancy cases. Here option B is the correct answer, ample. Commonest site of implantation of ectopic pregnancy is ample. Here we can see the ectopic pregnancy is present in the tube. You can see here fetus in the fallopian tube, ectopic pregnancy. Next, move on to question number 47. 47th question. Large placenta is seen which of the following cases? Option A, IUGR. Option B, syphilis. Option C, CMV. And option D, none of the above. Here IUGR means intrauterine growth retardation. Option C, CMV means cytomegalovirus. Here large placenta is seen in the following cases, means option B, syphilis. The congenital syphilis may cause the placenta to grow large and the umbilical cord to be swollen. The clinical manifestations of the large placenta in syphilis cases: enlarged hypercellular villi and proliferative fetal vascular changes, and also villi is also one of the clinical manifestations here. The large placenta we can see in option B, syphilis cases. Here option B is the correct answer. 48th question is least common type of pelvis is options: option A, gynaecoid. Option B, android. Option C, mixed. And option D, platypoid. Here the least common type of pelvis is platypoid pelvis. Here we will see the what is gynaecoid, what is android, what is mixed and what is platyploid. The commonest type of is gynaecoid pelvis here, but least common type is platypoid. We will see first option A, gynaecoid pelvis is 50% cases we can see. Gynaecoid pelvis is characteristics of women of the pelvis having a rounded from typical of the human in female. And option B, android. Android pelvis we can see in 20%. It is male pelvis, more robust and narrower, taller than the female pelvis. And option C, mixed pelvis. Mixed pelvis also called as intermediate pelvis, apart from these parent forms. Platyphyloid pelvis is 5%, also called as flat pelvis. Here, least common type is platypoid pelvis. Option D is the correct answer. Here we can see the in picture platyphyloid pelvis. We move on to question number 49. Golden color of amniotic fluid is seen in options. Option A, RH incompatibility. Option B, fetal death. Option C, IUGR. And option D, fetal distress. Normal amniotic fluid is clear and tinged into the yellow color, but here golden color amniotic fluid is seen in RH incompatibility cases. Option A is the correct answer. Golden color amniotic fluid indicates presence of bile associated with hemolytic disease. Fluid looks green or brown means baby has paused the bowel movement means meconium, while in the womb only. Here golden color amniotic fluid seen in the RH incompatibility cases, it is H incompatibility of the pregnancy. Okay friends, next move on to question number 5. Suction evacuation can be done up to options. Suction evacuation is a surgical procedure. We will discuss now. Options. Option A 6 weeks. Option B 16 weeks. Option C 26 weeks. Option D 28 weeks. Here suction evacuation is a surgical procedure in which the cervix is dilated or opened and vacuum is used to remove tissue from the uterus. This method can be used from 14 weeks to 20 weeks of the gestational age. Suction evacuation done sometimes after miscarriage also. Here option B is the correct answer. 16 to 20 weeks is exact time, but here 16 weeks is there in option B. Option B, suction evacuation can be done up to 16 to 20 weeks of the time. Dilatation and evacuation or dilatation of curettage also called as suction evacuation only. Here in this picture we can see the suction evacuation. Next move on to question number 51. Here ultrasound is diagnostic in options. Option A endometrial carcinoma. Option B cancer of cervix. Option C fibroid uterus. Option D none of the above. The ultrasound is one of the diagnostic evaluation test. The option B here cancer of cervix we can identify in the pap smear test only. Here option C fibroid of uterus. Ultrasound can be diagnostic for the in these following options. Fibroid uterus, option C is the correct answer. We will see additionally ultrasound is used to look at an unborn baby during the pregnancy. Ultrasound is a diagnostic ultrasound also called as diagnostic sonography, an imaging method that uses sound waves produce images of the structure within the our body and provide information related to the internal parts of the body. For example, liver, kidneys, heart, bladder and female reproductive system. Here the ultrasound diagnostic, here option C is the correct answer, fibroid uterus. Here we can see in this picture ultrasound scanning. Let's move on to question number 52. Which of the following disease cannot be diagnosed by amniocentesis? Here from the following option, one is not diagnosed through the amniocentesis. We will see the options here. Option A trisomy 21, option B Dutchness, option C cleft lip and option D none of the above. This video only in 45th question. We already discussed regarding amniocentesis. We will discuss short in this question. Amniocentesis we cannot diagnose option C cleft lip. We will diagnose in amniocentesis chromosomal and congenital disorders, for example trisomy 21 and Down's Edwards syndrome. These we can identify in amniocentesis. If prenatal ultrasound shows cleft lip, any cleft palate, doctor may advise sample of amniotic fluid for uterus or amniotic sac to identify the genetical conditions related to the chromosomal abnormalities in the womb to avoid the birth defects during the pregnancy period. Here option cleft lip, option C is the correct answer. Except this condition we can identify options. Next we can see here in this picture the cleft lip baby. Cleft lip baby. Okay friends. Next move on to question number 53. Following is false of placenta previa. From the following options, one is the false option in placenta previa. Option A, associated with toxemia. Option B, painless recurrent bleeding. Option C, maternal blood loss. And option D, severe bleeding may occur. Here in these cases, placenta previa cases, we can see painless recurrent bleeding, maternal blood loss also is there, and severe bleeding may occur. Here option A is the except or false option in placenta previa associated with toxemia. What is associated with toxemia? Disease caused by the spread of bacteria and their toxins into the bloodstream, also known as blood poisoning and septicemia. Here option A is the false allegation in the placenta previa. Option A is the correct answer here. Next move on to question number 54. Episiotomy is best done. Option A. Which of the type of episiotomy is the best? Option A, medially. Option B, laterally. Option C, J-shaped. And option D, mediolaterally. Mediolaterally is the correct answer. Option D. What is episiotomy? Episiotomy is a surgical incision of perineum and posterior vaginal wall. In mediolateral incision is done at the angle, it is less likely to result in the extent tear into the anal area. So episiotomy is the best in mediolateral. Here in this picture we can see mediolateral episiotomy in the right. Okay friends, episiotomy mediolaterally we are seeing in this picture. Next move on to question number 55. 486 is a options. Option A, anti-progesterone. Option B, anti-estrogen. Option C, androgen, anti-androgen. Option D, anti-gonadotropins. Here RU486 is a medication typically used in combination of misoprostol to bring about a medical abortion during the pregnancy. Okay friends, RU486 is also called as mifepristone. Okay friends, it can be used to manage the medical abortion during the pregnancy and manage early miscarriage. 97% of effective during first 63 days of pregnancy and also less effective in second trimester. It is 90-70% is effective in first trimester of pregnancy. Option here RU486 means anti-progesterone. Option A is the correct answer here. Next move on to question number 56. Post-coital test is used to assess from the following options. We will see options for cervical factor. Option A, option B, vaginal factor. Option C, uterine factor. And option D, none of the above. Post-coital test. What is post-coital test? Post-coital test is determines the adequacy of sperm and receptively of cervical mucus. It is the only test which evaluates the interaction between sperm and female genital tract fluid. Okay friends, it is one and only test to evaluate the interaction between the sperm and female genital tract fluid. Post-coital test can be performed in 1 to 2 days before the ovulation. We can test performed in 1 to 2 days before the ovulation. Here post-coital test used in cervical factor. Option A is the correct answer. Next move on to question number 57. Signs of separation of placenta are the following except. The signs of separation of placenta means the third stage. In third stage from the following one is the except option. We will see the options first. Option A, gush of blood is seen. Option B, lengthening of cord at vulva. Option C, fundus rises up to umbilicus. Option D, temperature rises. Here the signs of separation of placenta in third stage we can see gush of blood is seen and lengthening of the cord of the vulva we can see, and also some of the times temperature raise also we can see. But here option C, fundus raises up to umbilical, is except the option here in signs of separation includes gush of blood, change in shape of the uterine fundus from the discoid, and globular with elevation of the fundal height. So here option C is the except. Next move on to question number 58. Senile vaginitis is due to. Senile vaginitis is due to options. Option A, gonococcal infection. Option B, cancer of cervix. Option C, diabetes. Option D, estrogen deficiency. Postmenopausal ectopic vaginitis or vaginal atrophy we can see in estrogen deficiency. Here option D is the correct answer. Senile vaginitis is due to the estrogen deficiency. It is a thinning of the walls of vagina characterized by decreased estrogen levels in the body. Most commonly we can see after the menopause period, usually between the ages of 40 to 55 age. Here senile vaginitis is due to estrogen deficiency is the correct answer. Option D. Here we can see in this picture, first portion of the uterus is normal vagina, and second picture is the ectopic vaginitis and swollen and inflammation of the vagina we can see due to the deficiency of estrogen. Next move on to question number 59. The white creamy substances on the fetus is called as. Option A, white coat. Option B, milky path. Option C, vernix caseosa, and option D, none of the above. The white coat or white creamy substances on the fetus we can see in this. Option C, vernix caseosa in medical term. Vernix caseosa is a white and creamy naturally occurring on the skin of the fetus during the last trimester of the pregnancy. The WHO recommends leaving vernix caseosa on the baby skin for the at least 6 hours, but preferably in 24 hours of the after birth. Here white creamy substances on the baby skin we can see in vernix caseosa is called as vernix caseosa. We can see in this picture vernix caseosa baby. Creamy substances on the fetus, vernix caseosa. Option C is the correct answer. Next move on to question number 60. This is the last question in this video. What are the most common cause of death to women during the childbirth? MMR. We will see the options. Option A, hypoxia. Option B, malnutrition. Option C, diabetes mellitus, and option D, hemorrhage. The most common cause of death to women during the childbirth is hemorrhage. Option D is the correct answer. 75% of all maternal deaths due to severe bleeding and infection usually after the birth. The primary cause is hemorrhage, secondary cause is infection. Hypertension during pregnancy is the third foremost cause of the death of the woman during the childbirth. It will be preeclampsia and eclampsia. Okay friends, here the most common cause of death the woman during the childbirth is hemorrhage. Option D is the correct answer here. Till now we finished from the part of midwifery and gynecological nursing point of view 60 questions. We will discuss from the 61 question to 100 question in next video. Continue from the 61 to 100 in part 3 video. Till now we finished part 1 to 30 questions and part 2 30 to 60 questions. Okay friends, stay tuned friends. Thank you for watching my video. Please subscribe my channel, click on the bell icon for further notification. Keep watching.